has had a transfusion or transfusion reaction in the past.
Okay, that's very important information to know. If you know that he has had, let's say he's had a febrile reaction before, make sure the physician knows that, because he'll probably order something to prevent or ease that same response. Okay, like Tylenol or something like that.
Explain skills to the patient. Make sure there is a signed consent for transfusion if required by agency. Advise patients who report chills, itching, rash, or unusual symptoms. Perform hand hygiene and put on clean gloves. Hang container of 0.9% normal saline with blood administration.
Okay, stop there. So, a written consent for blood is always required. Okay. And there are times when someone may refuse blood. Do you know what religious group doesn't?
Jehovah's
Witnesses don't believe in it. And they let their H&Hs drop pretty low.
So who consents them? The physician, or can the nurse consent?
The nurse can witness a signature, but she cannot give the informed consent. In other words, the physician has to talk to them.
Okay.
What about in emergency situations where informed consent might not be possible?
Then it usually requires two physicians to sign that it's necessary. And that usually happens more in like an emergency room setting or whatever, typically.
When you say the H&H is dropping, you mean hemoglobin and
hematocrit, yeah.
Okay.
Get used to the lingo of things.
Do I continue?
Okay. All right. So, let's back up a second. So the next thing they said was hang normal saline. So blood's always run with normal saline. So if a patient has an IV going of something else, we have to start a new line. Okay, to hang the normal saline if they're needing that other IV for something. So, so you would. This is probably a Y set. By a Y set, they mean that it's like a Y. There are two tubes up here. So one is for the blood, one's for the saline. Okay. And blood filter. The IV set is Y-type blood solution set with standard blood filter. So that's typically what they'll be running. Okay, so,
So you're going to hang the container of the 0.9% normal saline with blood administration set to initiate IV infusion and follow procedure for administration of blood. You're going to start the IV with a number 18 or number 19 catheter if not already present.
okay. So, before you get started, you'd want to go ahead and prime your set. Okay? And when you fill this up, you just want to make sure that the filter is covered completely, so that when the blood starts to run, it doesn't drop from a distance onto the filter that hits the liquid. Okay, so you'd start your IV, have it all set up. And this is such a nice setup when you have this little extension tubing here. You're not trying to manipulate something right at the IV site. You have a place to work over here. So that's, everybody adds that, I think, in all clinical sites, that extra.
Oh, start the IV. Okay. Obtain blood product from blood bank according to agency policy.
And that you probably, as a student, won't be able to go to the lab to get that. Most procedures require that an RN or some special category of person pick that up. Okay.
Well, before that, I forgot to mention, keep the IV line open by starting flow of normal saline.
Okay. So you could go ahead, if you have, and start your IV saline running. Keep this other covered and clamped. All right.
Okay. Complete identification and check as required by agency. A, identification number. B, blood and type. C, expiration date. D, patient's name. E, inspect blood for clots.
Alright, they don't have a,
So you're not hanging the normal saline before you move on, you're just priming it, sort of thing?
yeah, you go ahead and hook it in.
Oh, okay.
Yeah, you can hook it up, have it start to run, and that way you're ready to go with the blood. Okay. They don't have the whole thing from the lab, but when it comes back, you verify the patient with the lab slip, and then there's also one that comes with the blood itself. We'll take a look at it when we actually get to the clinical site, what that looks like. And so it always requires 2 people to administer, to do the verification. It has to be 2 licensed people, both of which have the ability to hang blood. So it's typically 2 RNs. Sometimes they may allow the student to be the second one, kind of if I'm standing in the background or something like that. So what you're verifying is that it's the right patient, and the blood with the blood slip and order, that it's red blood cells, that what the RH factor is, what the blood type is. This is type A, right? RH positive. Volunteer donor, it's red blood cells. The number, you would verify that the numbers match up together, okay?
The expiration date.
And the expiration date. Up here, expiration date.
How can you tell if there's blood clots? It just looks different?
It'll look clotted. It'll be dark, like dark little strings or something like that in it. This is a little bit light. It's usually PEC cells are a little darker than that. But just look at it or hold it up to the light and see if you see any things that look clumpy or stringy or whatever it is.
So you want to take a baseline set of vital signs before beginning transfusion.
Okay. Do that, and there'll be a special place on the form where you write pre-transfusion, temp, blood pressure, pulse, respirations. Okay?
So you're going to start the infusion of blood product. You're going to prime inline filter with blood.
Like this. So you would connect your blood in.
Okay. Start administration slowly, no more than 25 to 50 mLs for the first 15 minutes. Stay with the patient for the first 5 to 15 minutes of transfusion.
Okay, so that's very important. So someone has to stay in the room physically with the patient for the whole 15 minutes, and they run the drip rate a little slower those first 15 minutes. Because if someone's going to have a reaction, then maybe you don't want them to get too much blood in before they start having it. If the patient does start to have a reaction, you immediately turn the blood off.
Okay, so we check vital signs at least every 15 minutes for the first half hour after start of transfusion.
So on the actual blood form, you write the 15-minute vital signs in here, okay? If the only change is in temp, but otherwise the patient's feeling okay, you would still want to stop the infusion and go double check with the physician if he wants to continue the blood or give him maybe a med or something with it, okay?
Follow the institution's recommendations for vital signs during the remainder of the transfusion. Observe patient for flushing, dyspnea, itching, hives, or rash.
Right, no signs of reaction. Now, how long do you have to get the blood in?
4 hours.
4 hours. And when does that clock start ticking?
As soon as it's taken out of the fridge.
Yes, down in the lab at the blood bank. Not when you actually hang it. So if for some reason there's a delay in actually getting it started, that time counts in there. So it's a good idea if you anticipate to make sure you have a good IV before you get your blood, if you have that opportunity, right? Because you want to, by the time you get the blood, you want it to be able to go. You don't want to get in here, be all set to go and find out, oh, there's no IV, you know, it's infiltrated, whatever, and have to start all over again.
Well, how long would it take to infuse a bag? I don't know.
No, usually, if it's packed cells, over 3 hours or so.
How much is in 1 unit of blood?
It is, I think it's 250.
Because in the videos they're like, oh, 1 unit, 6 units, whatever.
So you should start.
Yeah.
I mean,
Now, platelets usually are smaller and
Mm-hmm.
like 6 units for platelets is what.
Okay.
But like for packed cells, depending upon, you know, the hemoglobin hematocrit levels, how many they plan on giving. But they use, you know, one at a time.
Okay. Use a blood warming device if indicated, especially with rapid transfusions to a central venous catheter.
Right. So if someone is going to, again, they usually use that more like in a trauma patient or in the OR where someone's getting a lot of blood. They'll run it through a warmer, and it goes directly into the central line, because otherwise you can really cool, you know, if you're administering it quickly right out of the refrigerator, you're going to cool that person's core temperature by giving that really cold blood directly into the circulation. So you want to warm it up a little bit.
Maintain prescribed flow rate as ordered or as deemed appropriate by the patient's overall condition, keeping in mind the outer limits for safe administration.
Okay, so we usually don't run blood through the infuser. Why would that be? Through the pump.
Is it because you need to control it so tightly at the beginning? Like you only
Well, the pump can control it pretty good. But what does the pump do? It usually, a lot of the pumps have roller mechanism
Oh,
or
to
whatever,
clot
and
it
it
up.
crunches the tubing. So why wouldn't you want to squish the blood?
Cells?
Oh, and
Yeah,
crunches
you
cells.
can cause hemolysis of those blood cells. So that's why we don't typically put it on.
Assess frequently for a transfusion and allow saline to flow if you suspect a reaction. Notify a physician and blood bank. When the transfusion is complete, infuse 0.9% normal saline. Record administration of blood and patient's reaction as ordered by agency, and return blood transfusion back to the blood bank according to agency policy.
And it usually goes in like a little biohazard bag. So if there's a reaction, what do you need to do? Let's say you have a reaction, you stop the whole infusion. What would you anticipate would need to be done? You know,
administer oxygen.
well, if they
Take
have
vitals.
trouble breathing or, you know, a significant like an
Take
anaphylactic thing.
vitals.
But let's say it's just like a febrile reaction or they're feeling kind of itchy.
Stop the infusion.
So they may give Benadryl, right?
Call the physician.
Or epinephrine, if it's like an anaphylaxis, kind of a more serious, they would give epinephrine. Or if it's not quite so serious, maybe just Benadryl.
Notify the provider.
You notify physician, of course, the primary nurse would be in there too, but,
If they're having a reaction, do you still have to? Don't you have to get an order first before you give them anything?
oh yeah.
Yeah.
Yeah, you call right away for that. And if the patient really needed something, you can't get a hold of the physician, you need an order, you call a rapid response team.
Okay.
One way to get help if you can't otherwise. But sometimes just calling the physician, if they respond right away, you'll get what you need. If it's an anaphylaxis kind